here to help you level up your health. Now, first and foremost, as we all know, Nurses Day is around the corner. Now, I think we may have some nurses in the chat. Before we get going, ladies and gentlemen, in the chat, can you just type something, say hi, hello, happy Nurses Day. Now, it is in the same chat box where you'll get to post your questions for the Q&A segment later on. Right now, for those of you just joining us, thank you very much for making time. Again, this is the second time this year, and we're really excited. We've got brilliant people today. Now, we have for you Dr. Edgar Tay, cardiologist from Mount Elizabeth Hospitals, Dr. Alvin Tan, orthopedic surgeon from Parkway East Hospital, and Marcus Ng, our senior physiotherapist from Parkway East Hospital. Now, thank you, especially to those of you who have submitted your questions, our speakers during registrations. Now, if there's any more questions coming up, all you have to do, as I mentioned before, feel free to submit them using the Zoom chat anytime, and we'll try to answer them as much as we can during the Q&A session at the end of the webinar. Firstly, today we have for you Dr. Edgar Tay, cardiologist from Mount Elizabeth Hospitals. Now, he's here to talk to you on how you can improve your chance of surviving a heart attack. Now, let me tell you more about this man. Now, Dr. Edgar Tay is a cardiologist practicing at the Asian Heart and Vascular Center at Mount Elizabeth Hospital, Singapore. His subspecialty is in adult congenital interventional cardiology and pulmonary hypertension. Now, prior to joining private practice, Dr. Tay was a senior consultant at the Department of Cardiology, NUHC, also known as National University Heart Center, Singapore. He is also a program director at the Congenital Structural Heart Disease Program, NUHC, a visiting senior consultant cardiologist at Tan Tock Seng Hospital, visiting senior consultant cardiologist at Ng Teng Fong General Hospital, and many more. As you can see, this man is a legend. So at this moment in time, ladies and gentlemen, if you can join me, let's welcome Dr. Edgar Tay.
Thank you very much, yes. Thank you. Well, thank you very much for joining us this afternoon. Today, I'm going to talk about something very important, how to survive a heart attack. As you know, heart attacks can happen to anyone, whether they're young or whether they're old, and even cardiologists themselves. So we have even treated some of our own colleagues with a heart attack. So before starting, I'm going to show you a video where this will actually summarize on how you should recognize the symptoms of a real heart.
It started out like a totally normal day.
Can we get to the next slide?
Mom! Okay, move objection deadline to the third line after survey. Oh, honey, for when you always use the verb start. What are you doing down there? Did you finish your breakfast?
Yes, ma'am.
Don't hit your brother. Honey, you have to eat something. Here. Okay, 5 minutes to carpool. Where's my coffee?
You okay, Mom?
Oh, I'm fine. Sandwich orders. What do you want?
Almond butter and jelly.
Spaghetti.
You sure you're okay?
I'm fine, sweetie.
I am so late. Hey, buddy, how you doing? Hey, honey. You okay?
Yeah, I'm fine.
You sure?
Oh, yeah. Here.
Acai, my favorite. See you guys later.
Where are your shoes? Put your shoes back on, please. You know, go help your sister. We're going in 3 minutes. Oh my God, what am I doing? I forgot to cut off the crust. Voila. Shoes on, potty if you need it. Honey, get your sister. Okay, get her shoes. Nobody move. I'm getting a dustpan. Oh.
Mom! I think you're having a heart attack.
Honey, do I look like the type of person who has a heart attack? I'm just gonna sit down. I'm totally fine. Don't forget to wear the high socks with the shin guards.
Forget about the shin guards, Mom.
Come on, Mrs. Underdog is not gonna wait. Whoa. Okay. 9, 1, 1. Hi, sorry to bother you. I think I might be having a little heart attack. Nothing really, just some nausea, tightening of the jaw, dizziness, shortness of breath, muscle pain, achiness, this terrible pressure in my chest. Oh, really? They can be here in how long? 2 minutes. Can you make it 10? I thought I had gas. Turns out I was having a heart attack. Heart disease is the #1 killer of American women. So now I take care of my heart and I tell the women
Yeah, so this is a short video, but it actually shows very important things. So you see this lady, she has classically all the signs of heart attacks, but it's very common for all of us to discount it because we always think, oh, maybe it's something else, maybe it's gastric problems. And the main thing is if the symptoms do not go away, you have to act on it. So if you look at the slides now, heart attack actually is a very common thing in Singapore. So we have about 31 cases per day. So that's a high number in the whole of Singapore. And 1 out of 10 patients, if you don't manage them properly, they will have an increased chance of dying in 30 days after a heart attack event. So in order to understand what actually happens in a heart attack, we need to know what actually happens in our heart arteries. So arteries are like tubes. So if you do a cross-section of the tubes, you will see a little ring like a circle. And when we are born, all our tubes are very clean, just like any pipe that is just bought off the shelves, very clean. And if you start eating junk food or you don't take care of yourself properly, a layer of cholesterol will start depositing inside the ring. And you see with time, more and more fat tissue gets deposited. And at some point, this is going to cause harm. So what actually happens is that actually there's a thin lining of almost like a skin that covers all this fat tissue inside this ring, like your arteries. And sometimes when blood flows over this thin layer, you can fragment the layer and you get a crack, what we call erosion. And that is what happens then is when blood is flowing through these cracks, they form a clot. And this clot that causes a heart attack. So if you look at this video now, if we play this video, you will see that this is blood flowing through. And suddenly you have a fracture of a plug of a cholesterol area. And that immediately creates a response. The blood starts to form a clot. If this clot can form really quickly, in a matter of minutes, you can have a blood clot that clogs up the entire artery. And that's how an attack actually happens. So the heart is made of these tubes or arteries, and the arteries actually serve purposes of just how a river actually supplies water to a plantation. So if you look at the arteries, there are actually 3 major arteries in our heart. And what actually happens is that our body requires oxygen and nutrients from these arteries supply, just like how water is needed for the plantations to grow. So what happens is if you choke off this blood supply through a heart attack that I showed you earlier, the heart's going to withdraw. So here what happens, if you have no blood flow, it's just like no water to the plantations, all the plants will die. All the cells in the heart in the same manner will die. And what will happen is the heart becomes very weakened. And this is what we call end-stage heart failure. This is what happens when a heart attack is not treated early. So the outcome of a heart attack can be very dramatic. So a patient who have a heart attack because the clot now is forming and it blocks up the arteries totally, it can lead to what we call immediate danger or even death. So a patient typically will collapse. And if you don't react fast enough, or there's a person jumping into CPR or using one of these AEDs that you see a lot of these AEDs in condos or in the flats, if you don't put this up enough and you don't shock the patient fast enough, you will lose the patient. In the setting of patients who are fortunate enough to sustain life and still be able to survive through, will reach the hospital. And if we don't get the arteries open quick enough, they will develop end-stage heart failure, which means they will always be short of breath. They have leg swelling and they'll feel fatigued all the time. So really to survive a heart attack, you need to recognize the symptoms. Just like in the video, if the little boy had already seen the mother have all these symptoms. So the first thing, recognize the symptoms. Number 2, quickly call for help. And what is the easiest way? Call for the ambulance, 995. And the third thing is the ambulance has to get you to the hospital in the shortest time possible, because every 30 minutes delay means a 7.5% chance of dying. So to reiterate what the symptoms are, chest pain or discomfort is the most common, shortness of breath, upper body discomfort that can be even in the neck or the jaw, and sometimes associated nausea or lightheadedness. There will be some patients, especially in diabetics or patients who are, especially females as well, they may not present with the classic symptoms of heart attacks. So sometimes they can present with things like shoulder pain, back pain, abdominal pain, or even just dizziness. So if the symptoms don't go away, please look for a doctor for them to check you out. But we cannot be reacting to patients only when they get heart attacks, because that is really too late. So if that happens, we have a very short time interval to save this patient. So we really need to do better. So how do we do this? We need to do 2 things. We need to screen patients early, and we need to assess their risk. So risk assessment and screening are the 2 major tools that you can invest in to save yourself. So what are typical risks? A lot of you know this. Some people call it a sun cow or a tree high. So you have high blood pressure, high cholesterol, and diabetes. Other risks will be things like smoking, family history, or increasing age. And one of the things that many people forget is also stress. So stress levels that are very high also is a risk factor for heart attacks. In Singapore, there's actually a very interesting calculator. So if you go to the internet and type out this thing called the Framingham Risk Score, the Singapore modified version, you can actually do a blood test with your GP and put your numbers or your variables into this computer, to the internet calculator, and it can give you a risk of what your current profile is and how likely are you going to get heart disease in 10 years. So this is just an example. For example, if you put your numbers in, your cholesterol levels, your family history and everything in, you will get what was called a point score. And if you look at the points, if you are Chinese, for example, and you have 15 points, you have a 9% chance of having significant heart disease in 10 years. If you're Indian, that same number of points make you 19% more likely, because we know the Indian ethnicity creates a higher risk for developing coronary disease. So I'll give you some real-life examples of patients that we have seen that we have kind of prevented the heart attack, these patients. So patient one is a businesswoman, very, very successful, super hyper, so every time doing something. And one day she told me she was feeling more short of breath during meetings and asked, could it be this just anxiety? And if you go a little bit more and do a blood test and screen her, we found out that her cholesterol is elevated. She had early diabetes, really does not exercise. And the second guy that we met also that prevented a heart attack was a banker. Again, very high stress work. He does exercise, but he's a foodie. So every day he's finding out nice places to eat. So he exercises very aggressively, he runs, but he still eats unhealthily. So he has risk as well. And when we evaluated him again, we could find a typical risk in the blood test. So one of the tests that you hear about is something called a stress test. A stress test is a treadmill test. And how a treadmill test is done is really, we hook up ECGs on the patient. We bring the patient to the lab, and it's a very simple test. There's no injections. We put you through a treadmill, literally, and we monitor how your heart behaves. So this guy is starting to run. The treadmill has essentially a few stages. So every 3 minutes, it goes faster and faster and faster to create an increased heart rate and try to stress and see whether heart can cope. If the treadmill test, if you pass it, the probability of having blockage in the heart arteries is low. If you fail it, then the probability of having blockage is high. So this is something easy to do for many patients. More advanced testings are now available as well. So we have things like CT coronary angiogram, where you go into a CT scanner, and you inject some contrast, and within like 15 minutes, you'd have a picture of the entire coronary artery, just like what you saw earlier on, the tubes. So the 3 tubes will all be clearly seen. Whether you have cholesterol in there or not, it will be very clearly obvious to you. What is most accurate in diagnosing or treating patients with established coronary artery disease and preventing a real heart attack is something called an angiogram or an angioplasty procedure. So here what you see is a patient who have already been diagnosed to have significant blockage in the heart arteries, and now we actually have to go in and try to treat this patient before they get a full-blown heart attack. So through the little artery in the hand, we put a little tube in, and we did an X-ray to see, and you can see actually the blockage in the arteries. And in order to fix this blockage, we have to put in a balloon instead. So we put this very small catheter or tube into the patient's hands, and then we inflate the balloon. And these blockages are actually sometimes in the early stage very soft. They could be like plasticine. So you push it up, the blockage gets pushed to the side. Sometimes they could be calcified or harder, and then we have to do more work. And eventually a stent is put in to improve blood flow in these arteries. And so this is a real-life example of what we actually see. So if you see these patients, they will have wires and tubes inside the arteries, and you see a little thing moving there. That is the balloon and the stent. And after you put in the stent, of course, the arteries are now restored. The blood flow is now better. This is the picture of the banker that we spoke about. On the top 3 pictures that you see, these are actually arteries that are very healthy. And the red line that you see now actually designates how a normal artery will be able to supply blood nicely to all the tissues to the heart. But in these patients, the red artery that you see is missing on the left, It is occluded in another artery, and on the right side, you see all these rings. These are all the spots that have blockages. So this patient has very, very extensive blockage. This is after eating a bak chor mee. So what happened? We can't do stents in these patients. They end up having a bypass, which is a good treatment as well, because this will last the patients for a long time. So by taking arteries from the hand or from the legs, they can bypass these blockages and improve flow to the heart. But can we do even better than traditional risk factors? I think we can. So this is actually the last slide for today. We take home. See your doctors early. Men more than 40 should be start screening. Women more than 50. Always start healthy, especially if you have young children. Start them with a healthy lifestyle early on so that it becomes habitual. Lab tests, the routine ones are easy to note. Now we know that there are also advanced cholesterol tests like LP(a), which you can actually look for risk factors beyond the traditional risk factors. And we also have things like CHIP, which is the newest generation test for risk assessment. So if you do this test, you look at a mutation in the genes that's circulating in your blood and the cells, and that can tell you a risk of heart attacks, say, in the next 2 years. So we have a whole armamentarium of tools to prevent and to screen patients. And with doing that, you can prevent a very serious heart. So thank you very much for your attention.
Thank you. Thank you very much, Dr. Stay. It was enjoyable. Thank you. We learned so much from you. Thank you very much, sir. Thank you. Wow. Ladies and gentlemen, we're just listening to Dr. Tay, and there's so many things that we've learned and picked up along the way. Now, early detection, all right, early screening is always very important. Now, ladies and gentlemen, before we move on again, any questions that you have, especially we have such great speakers today, please send in your questions via the Zoom chat, because in the end, when we have the Q&A session, we'll try to address your questions as much as possible, as many of them. So please do send in your questions. For those of you looking at this, watching this webinar, please do send your questions via the Zoom chat. Now, next, it's going to be an amazing topic. Now, for those of you struggling with knee pain, stiffness, swelling, that's slowing you down every step of the way. Now, don't let it hold you back. Now, in this session, orthopedic surgeon Dr. Alvin Tan will walk you through the medical options available to you to relieve knee pain and restore mobility so you can get back to the active lifestyle you love. Now, from medication, biologic, and hyaluronic injections to minimally invasive surgery options, learn how modern treatments can help you manage symptoms and prevent long-term damage. So ladies and gentlemen, Dr. Alvin Tan is an orthopedic surgeon at Parkway East Hospital. He has an interest in partial, total, revision, and robotic hip and knee replacements. If you can join me, Dr. Alvin Tan.
Thanks, James. Hi, good afternoon, everybody. Thank you very much for spending your lunchtime with me. Over the next 20 minutes or so, I'll be talking to you on this very, very common topic, which is knee pain. Now, knee pain, a lot of people have, right? From young people playing football, then kena knee pain, to your old ladies who are walking bow-legged. Remember, your akong, your ama, so have knee pain when they go up and down stairs. These subset of patients have what is called a degenerative condition of the knee or wear and tear condition. And this is what we are going to be focusing on today. All right? So, like I said, knee pain, very, very common. Also, many, many causes. And we have so many names for all this condition that it's not surprising that a lot of people are confused over what we are talking about. So commonly, osteoarthritis is mistaken for things like gout, rheumatism, and even osteoporosis. Before I go on to talk about what osteoarthritis is, I will briefly talk about what these conditions are. Gout essentially is a condition of metabolism where there's an accumulation of crystals inside your body, in your joints. It presents very much like arthritis, but it's usually a lot more painful. Your knee gets more swollen, there's redness, and its onset is a bit more acute, so it hits you suddenly. So if you have those conditions, more likely gout, especially if you have a family history of gout. Rheumatism is a whole different kettle of fish. Although the end stage is that it results in cartilage damage just like osteoarthritis, it is actually an autoimmune condition where your body attacks itself and destroys its own cartilage. Osteoporosis and osteoarthritis very commonly mistaken because they all have the words osteo inside there. So essentially, osteoporosis is a condition of the bones. So a lot of my patients ask me, "Hey doc, I got knee pain, can I take calcium or not?" It's not really related. You take calcium for osteoporosis, but calcium not really effective for osteoarthritis. So what exactly is osteoarthritis? Now, if you have eaten chicken drumstick before, right, you see the end of the chicken drumstick, or this shiny white thing. That is the cartilage inside your joint. It is this cartilage that's responsible for your joints being able to move smoothly and freely without any pain. All right. So if you see on this cartoon on On the left side, you can see what normal cartilage looks like. Nice, shiny, and covers the entire joint. But over time, as the cartilage starts to get damaged and starts to get worn out, then you start developing little cracks and little holes inside the joint. Initially, only affects one part of the knee, but subsequently, as things become more and more worse, or it can affect the entire knee joint as well. All right, so that is osteoarthritis. Now, why do people get arthritis? All right, the most important factor is age. All right, it is a wear and tear condition. The more you use your knee, the older you are, then there's a more chance that your knee wears out and you start developing symptoms of osteoarthritis. Unfortunately, just one step back. So as you cross the age of 65, 1 in 5 people above the age of 65 will have knee arthritis. So very, very commonly in our elderly friends. Women, unfortunately, also have a slightly increased incidence of knee osteoarthritis. And there are many reasons for this. Number one is that the cartilage of women tend to be thinner to start out with. So as time goes on, it wears out a little bit faster. And we know that menopause and hormonal withdrawal also has an effect on arthritis and cartilage health. So unfortunately, women do have a higher incidence of arthritis. But you can't choose your age and you can't choose your gender, right? But what you can definitely choose is your body weight. And we know that among the modifiable risk factors, obesity is the most important one. If your BMI crosses 30, which is the definition of obesity, then your risk of knee arthritis just skyrockets. And it's a very, very simple physical principle. If there's more stress and more weight that goes through your cartilage, they degenerate faster. Also, if you have previous injury, like just like what I was talking about just now, you play football, play basketball, you twisted your knee and you have injury, then it's quite important that you see your doctor early to get treatment, because some of these injuries result in abnormal stresses passing through the knee, and that can lead to accelerated osteoarthritis. So what are the symptoms of arthritis? All right. So pain, swelling, stiffness, and deformity. Pain initially happens when you're doing vigorous activities, right? So maybe when you're running or when you're playing sports. But over time, these symptoms worsen, and you will find that even normal walking on even ground, flat ground, may cause you pain. A typical progression of pain in knee osteoarthritis will be a low level of pain on most days. But occasionally, these pain spikes up to, let's say, a pain score of 6 or 7 out of 10. And then with treatment and with rest, this gets better. After a couple of days or weeks, then you go back to your baseline level of pain. But gradually over time, this low level pain becomes worse and worse, eventually until this pain can affect your function and your daily activities of living. In a lot of patients, we also find that they have problems negotiating stairs. Initially, when going downstairs, then sometimes going upstairs, which is why sometimes you see outside our older patients, instead of walking steps, just like how we do with taking one step at a time, they go down either sideways, because that places a lot less stress on the knees, or they put both feet on the steps before they transition to the next step. Squatting also becomes problematic. Swelling is quite a common feature of osteoarthritis. So these, just like the symptoms of pain, can come and go. Right. So occasionally your pain your knee gets swollen like a basketball. Then once you rest, you elevate your leg for a while, it comes out again. All right. Remember just now when I was talking about gout, I did mention that gout can give you swelling as well. The difference between this and gout is that the pain and the swelling in gout tends to be a bit more sudden, acute, and a lot more painful. Whereas the swelling that comes on your knee osteoarthritis is a little bit more insidious and slower. With all this pain and swelling over time, you develop two things, all right? Number one, you get stiffness in your knee. The amount that you can bend your knee is no longer as much as what you can in the past, and your knee becomes more and more stiff. Sometimes this stiffness occurs early in the morning when you first wake up after you've slept the whole night, where all your soft tissue had time to contract. So after you walk a few minutes, it gets a little bit better. In the end stage, then your knees start to become crooked. Very, very commonly, we see what is known as bow-leggedness, or what we call a varus knee, all right? So exactly like you see this old man in this picture. Okay? Walking around like a cowboy like that. But occasionally, the knees also flip outwards. They go to the other way around, called a valgus knee. All right? And in some patients, you get one knee that's bent inwards and one knee that's bent outwards, almost like the wind is blowing them to one direction like that. So those are called wind swept knees. So these deformities are very, very common in patients with rheumatoid arthritis. So if you have all the symptoms that I just mentioned above, how do you know when you need to go and see a doctor? Because knee pain, like I said, knee pain is very common. Well, a lot of us, knee pain 1 or 2 days after that, then it gets better already. So if the pain is affecting your function, for example, you cannot go up and downstairs. You want to go downstairs to the coffee shop to go and buy coffee, you are screaming already. You will need to come and see the doctor. If the pain is lasting for more than 2 weeks, and especially if it doesn't get better when you take simple painkillers prescribed by your family physician, then you should also come and see a doctor. The last reason to come and see us early is when you have very, very bad deformities of the knee. Especially, when you walk, you find your knees very, very unstable. You're rocking left and right because of the deformity. Then again, you should come and see a doctor. When you do come and see us, then what is the aim of treatment? It's very simple. Orthopedic surgeons deal with things very, very simply. We just want to restore you to the function that you previously had and that you desire. So some people want to go skateboarding like that. Most people, they just want to be able to walk up and down stairs, go and do the activities of daily living, go to work without any pain. So that is what we want to do. Treat your pain to restore your function. Okay? So very commonly, people ask me, Doc, what can I eat to make my pain better? There are a lot of medication out there. All right? And because these are supplements, not regulated by medication, there are many, many types of and put many things inside there, right? Many, many different combinations and not always regulated. So it's very, very tough to say whether these things work or not. But there are a few that stand out that we know over the period of years through research that they do work. All right. Glucosamine has been very, very popular over the past 10, 15 years, right? We have been giving them like candy for knee pain. Initially, when it first came out, we thought this was God's gift to knee arthritis because initially it seemed to work very, very well. But I think with research over the years, we find that the result may be a little bit more modest than what we think. Generally, because there's not much side effect and they're fairly cheap, most doctors will still let you try glucosamine for a short period of time. But we find that the effect of glucosamine not to be as strong as what we thought they used to be. The next thing that's coming up is collagen, right? Collagen, very popular. A lot of people take it for their knee, but very, very commonly people also take it for their skin. So, unfortunately, the formulation for your skin and for your knee is a little bit different, all right? So you do need to take unhydrolyzed or undenatured collagen for your knee condition. Collagen, while it is a building block for your cartilage, also has an immune function. Taking these collagen helps the body recognize these collagen molecules so that it doesn't attack itself and destroy the cartilage. So what I just described, glucosamine and collagen, belongs to this group of supplements that are the building blocks for cartilage. And the purpose of taking all these things is try to preserve your cartilage and prevent degeneration. But there's a whole other group of supplements out there that helps to decrease inflammation. All right, and a lot of people are taking these just to reduce the inflammation generally inside their body. So we have things like turmeric, ginger, and even capsaicin. Capsaicin, not taking orally for reducing inflammation. You can apply it topically onto your knee to help relieve pain. So everything added together with the collagen just sounds like a very good recipe for curry chicken. But curry chicken doesn't help you with your knee pain. Okay. Another thing that's quite important is vitamin D now. All right. We know that with vitamin, right? So just now I did say that osteoarthritis and osteoporosis are different conditions. But let me correct myself a little bit now by saying that there is a little bit of link between weak bones and osteoarthritis. Because we find that in patients with very, very weak bones, especially in patients who are deficient of vitamin D, there are small cracks that can develop underneath the cartilage in the bone. And that leads to traces support for the cartilage, and you can get pain as a result of this lack of support for your arthritis. So vitamin D, while traditionally used to treat osteoporosis, can also be quite useful to arthritis. But generally, these are two very, very different conditions that are treated separately. Okay, what about injection? Man, these come in many, many different flavors, all right? People make their own cocktails and different type of injection. But generally, they fall into three groups, okay? First one is steroids. Steroids are a very, very bad name. People think that once I take steroids, I am this muscle man or bodybuilder who's abusing steroids. No, steroids are very, very important medication for doctors, all right? And we use them to reduce inflammation. And when used correctly and when used appropriately, they don't go to the rest of the body and cause side effects, all right? When injected into the knee, they reduce the inflammation. It helps to reduce your pain and symptoms quite quickly. Having said that, long-term use and frequent use of steroids can lead to problems, including infections and destroy the cartilage itself, paradoxically. So we limit the use of steroids to patients who are maybe not fit for surgery, not fit for other forms of treatment, or patients who are very, very old who don't want surgery. Hyaluronic acid is another interesting. It's this gel that we can inject inside the knee. A lot of people think that this is like going to the car workshop and changing oil like that. Every 3 months go for a knee injection. No, this we don't pop your oil inside your knee. All right. Hyaluronic acid is a lubricant that we inject inside the knee, helps to reduce the friction between the cartilage and also help to reduce the inflammation. Why like one chicken, one rooster comb down there? Because that's where hyaluronic acid used to come from. Right, you took the rooster's comb, we broke it down, and we extracted hyaluronic acid from there. All right. Thankfully, nowadays we don't do that anymore. Most of the time, it's coming from bacteria that we use genetically modified bacteria to extract hyaluronic acid from. Hyaluronic acid quite good in patients who have early arthritis, and can help to relieve the symptoms and delay the need for surgery for several years. There you go. Forgot about this slide, but younger patients who have mild disease, we do give hyaluronic acid. All right. Very popular nowadays is regenerative options. Everybody wants to be younger. Everybody wants to be like 18. Too bad I got no miracle medicine to give you to make you 18 years old again. But we do have molecules and injections that we can give inside the knee that can help to modulate the immune system. And very often these injections will require us to take your own blood. We spin it down, we process it, we take the useful bits of your serum, and we inject it back inside the knee. What that does is these chemicals and cytokines and molecules inside the serum helps to reduce the inflammation inside the knee. And there is some early evidence that it can help the cartilage to regrow. But that one we akan datang. We wait for more information first. Okay? So those are all treatments or non-conservative treatment and or non-surgical management of knee arthritis. The purpose of doing all these things is to reduce your pain so that you can go and see the next speaker, Marcus, all right, for some physiotherapy. Why? Because physiotherapy is the most important. Doing exercises, training the muscles, helps to decrease the stress and pressure inside the knee so that you can preserve your cartilage for as long as possible. But there will be one day where the pain gets so bad, you sit down and you're saying, Doc, I cannot tahan anymore. I cannot stand this anymore already. I need something more than just what you've given to me previously. And that's where we start talking about knee replacement surgery. Okay? Knee replacement surgery essentially involves the doctor bringing you to the operating theatre, putting you to sleep. We shave away the bits of the cartilage that's damaged, and then we replace the parts that we have taken out with an artificial joint. All right? So we got a piece of metal cap on the thigh bone or the end of the femur. We've got a metal plate on your tibia, which is the leg bone, and then a piece of plastic in between that acts as your new cartilage. All right? So this is a new joint. Everybody, when they hear about knee replacement surgery, has an image like this, okay? You think of your uncle, your grandma who had surgery 15, 20 years ago, all right? After surgery, they are screaming in pain, 2 or 3 tubes hanging out of them. They cannot walk for 2 weeks after that. And they absolutely hate the experience. I'm quite glad to report that the modern knee replacement is no longer like that. Okay? And part of it is this thing called enhanced recovery. Enhanced recovery takes best practices from the physiotherapist, the anesthetist, from all the surgeons. We stitch them together and we make rapid recovery a goal of our knee replacement surgery. A modern knee replacement surgery goes something like this. Before surgery, you do a bit of physiotherapy, all right? You train up your muscles, you get your knee and your body ready for surgery. You come into surgery on the day of surgery. which takes about an hour and a half. And after that's done, you are walking the same day. Gone are the days where you're lying in bed in pain for 2 weeks, all right? The physiotherapist will help you walk on the same day. No more tubes, huh? No more tubes coming out from your spine, no more tubes coming out from the knee, no more tubes coming out from where you ask your rate. You'll be just like normal, you'll be walking well. Some patients, the young ones and the healthy ones, potentially can go home on the same day. But most patients may stay a couple of days just to get a little bit more physio in. All right? And full recovery for this, for knee replacement surgery, is 6 weeks to 2 months. You'll be walking well without any aid. And this is all thanks to ERAS, the Enhanced Recovery Pathway. There are quite a few other advancements in knee replacement surgery, namely robotic surgery. Now, don't think that this is AI or robot doing the surgery for the doctor. No, the doctor is still very much in control. All right. Robotic surgery starts with us pre-planning the surgery using software models of your knee we get from X-rays or we get from scans. We will create an artificial model of your knee, and then we plan how much bone, how much cartilage we need to shave off. We plan where we need to put our implants. All right, and then this is then transmitted to the robot. During surgery, the robot helps us to put the instruments in an optimal position, but whatever sawing or whatever implantation is still completely done by surgery. So no AI-driven surgery for you now. And this is an example of a patient that we did a knee robotic total knee replacement in. Well, we planned for the surgery initially with the real-time data that we collect during intraoperatively. We can fine-tune the position of the implants to give the patient the most optimal outcome. All right, so there is no doubt that robotic surgery is more precise, accurate, and like I said, with information collected intraoperatively that the robot gives me, I can plan my surgery much more accurately. Is robotic surgery for everyone? Well, the truth is, no. All right. If you are older than, let's say, 70 years old, the increased accuracy and precision may not benefit you. All right. Because the truth is, a conventional or non-robotic total knee replacement is already very good. All right. But if you're a little bit younger, let's say 65 or younger, where you want your knees to last a long, long time, like Singapore, the women can live till 80, almost 90 years old, and men can live till 85, right? So if you are operating at 65, you need your knees to last you 20 more or even 30 years. So in patients who are very, very young, then a robotic surgery may actually be beneficial to help the implants last as long as that. Okay, so thanks for sticking with me. Very, very quick job. But let me summarize what I've told you guys so far. We can treat the pain from knee osteoarthritis very effectively. There are multiple agents, both orally and injectables, that we can use. Don't be scared of surgery. All right, surgery can be a comfortable process, so that we can restore the function of your knee, so you can go back to whatever you want to do. You no longer have to suffer when you're going for your cruise holidays or climbing up mountains in Japan. Okay, so I think that leads to the end of my talk. I'll hand over to the next speaker. Thanks for sticking with me, and I'll be back to answer your questions later.
Hey, thank you for the time.
All right, thanks.
Thank you. Another amazing presentation. Now, ladies and gentlemen, we're so lucky to have these speakers coming in. Listening to them is like listening to a masterclass on how to live your life healthily. No, our next speaker is going to be absolutely amazing as well. Now, for those of us going through the early signs of knee pain, common factors that contribute to it, now we have for you Marcus Ng, a senior physiotherapist from Parkway East Hospital. Now, it's here, Marcus, we're here to share you actionable tips, simple daily habits, targeted exercises, and lifestyle changes to help you prevent discomfort, improve mobility, and most importantly, to strengthen your knees. So, ladies and gentlemen, at this moment in time, let's welcome Marcus.
Thank you, Jim. Let's start.
Hi everyone, I'm Marcus, a senior physiotherapist at Parkway East Hospital. So today I'll be sharing about some simple tips that we can do to actually help with the management of knee pain. So we'll be talking about some facts and fiction about knee pain, as well as trying to understand some common causes, as well as some early signs. So learning about some simple tips and exercises that we can do to help with our knee pain, and also, most importantly, trying to understand when we need to seek professional help. So why knee pain matters? So when we have knee pain, it definitely affects our ability to engage in our daily activities. With knee pain, we have challenges going about our simple activities, for example, like climbing up and down the stairs, and even being unable to sit long because of having this knee discomfort. So we cannot sit long to work on our desks. And also with all this knee discomfort, it will also end up affecting our mood as well as our day-to-day energy levels. So here are some statements about knee pain, and then we'll go through every of them one by one. So knee pain is part of the aging process. There is nothing I can do about it. So is this fact or fiction? So when we talk about this, I would say that it is more of a fiction, whereby knee pain, no doubt, is part of the aging process whereby our joints age, but there are definitely some things that we can do. For example, we can engage in some simple exercises to really strengthen the muscles in the area, as well as if there's some tightness in the muscles, we can definitely work on some flexibility exercises. And next statement we're looking at is rest, the best solution for knee pain. For this, I'll say yes and no. Definitely the initial stages when pain is at an elevated level, most of us will usually end up having a rest first. So if let's say after resting for about a couple of days and we find that the knee pain is indeed getting better, so it does not mean that we have to completely rest for the knee pain to resolve, but rather perhaps it's time for us to start doing some exercises to actually get the knee stronger and back to where they used to be. And so we look at the third statement, which talks about whether exercise will aggravate knee pain. So contrary to a popular belief, exercise is actually beneficial in the case of having knee pain. So when an individual has knee pain, definitely things that physios do is look at how some specific tailored exercises will actually help to bring down the pain and definitely restore your movement pattern step by step as the pain continues to improve. And lastly, one common thing that we look at is how body weight, whether it has a link to knee pain. So this statement looks at whether does weight loss reduce the load going through the knee joint. So I think a lot of research out there has shown that for individuals with excessive body weight, a 1 kg reduction in body weight actually leads to a 4 kg reduction in the weight through the joints. So definitely in such individuals, perhaps weight loss could be a consideration in terms of improving the knee pain. So some early signs and symptoms that we want to take note of are, for example, when you start getting some stiffness in the knee, for example, when you wake up in the morning, you find that there is some difficulty with movement, but that improves with rest, then that is fine. But also, at the same time, we're looking for whether there are any occasional aches in terms of, for example, when you're going about your daily activities, walking about and you feel some aches in your knee. As well as, lastly, looking at whether there's any discomfort during the movement, whether you're going about your daily activities in terms of climbing stairs, going for your long walks, or sitting on your desk to do your work, whether there's any discomfort during your knee movements. Right. So some common causes that we see in knee pain in professionals include the following. So some common causes include prolonged sitting. So for example, in our modern day work environment, at times we're required to sit on the desk for longer periods of time, whereby we are on our desk working on our work tasks at hand. So occasionally, sometimes this prolonged sitting will actually lead to a reduce in terms of usual blood circulation in the knees. So whereby these prolonged positions actually lead to additional loads in the knee as well. And so all these may actually cause some knee pain. So secondly, looking at some poor ergonomics. So for example, if you are sitting on the desk, for example, like many of us currently are perhaps, so when sitting down on the desk, if let's say your knees are perhaps in an awkward position, for example, if your chair is slightly too high or if your desk is slightly too forward, so this may actually place unnecessary increased stress in the knee, whereby it may actually result in you having some knee pain. So I think last but not least, we talk about lack of movement. So at times when we are so caught up with our day-to-day activities, we end up having to use exercise as a last resort, whereby it's more of exercise takes a back seat, whereby this lack of movement actually results in increased occasions of knee pain, stiffness, and discomfort that occurs. So now it's time to get moving. So I think definitely for this next segment, so we have spoken about some common causes of knee pain and then what signs to look out for. So perhaps it's time for us to try some exercises that we can easily do at home to actually work on knee pain to ensure that we reduce the stiffness and discomfort. All right, so I'll bring back James to come in and join me for this session. So whereby we'll do some demonstration of the exercises. Feel free to join us if you are seated comfortably on a chair, and we can do some of these exercises. All right, thanks, James. Okay, so for exercises-wise, generally, some exercises that we look at include some flexibility, mobility exercises, looking at stretches, as well as foam rolling, as well as, most importantly, the strengthening components to get the muscles stronger. So for the first exercise, I'll get James to join me for this segment. So James, feel free to take a seat. Right, so for this exercise, what we'll do is a simple stretch at the back of your thigh. So James, for this exercise, I need you to sit comfortably in the chair. Right, can you place your right foot forward? Yeah, okay. Yeah, so sit comfortably and keep your knee as straight as you can. Right, so if it's a little difficult to keep the knee straight, so what you can do, sit slightly forward. Right, so when you're doing this, place both hands on your thigh. And then to do this stretch, what we need to do is, James, let's sit upright and lean slightly forward. So lean to the point whereby you feel a slight pulling feeling at the back of your thigh. So the thing for stretches is usually some misconception is that no pain, no gain. But I would say it's not necessarily true, whereby we are aiming for a mild, comfortable stretch. James, what are you feeling now?
Mild comfortably.
Yes. Yeah, so the idea is just a mild stretch. So whereby we want to stretch out the muscles, hold it there for about 30 seconds, and we'll do that for 2 times for effective stretch. All right, okay, let's relax, James. All right, so moving on to some other exercises that we can potentially explore. So we have a thigh stretch that we can do over the front of the thigh. All right, so what we will do for this is we will pull the right leg up. So whereby you feel a gentle tug at the front of your thigh. Right, so when we do this stretch, same thing as well, gentle pull, go for 30 seconds, 2 times is adequate to achieve an adequate stretch effect.
Oh, yeah, this is what I do with my runs.
Oh, so this, okay. Yeah, so definitely this is something helpful, especially for runners, just for a bit of stretching, flexibility work before you go for your runs. All right, okay, good. Moving on to the next exercise. So definitely let's talk a bit about calf stretch. So whereby what we are doing is when we place the foot behind, so with the heel in contact with the ground, so we bend the front knee, and then you feel your body weight pushing through your heel, which is the left heel. James, you feel a pull at the calf area?
I do.
Yeah, so definitely just feeling a slight pulling feeling. Just go there, same as well, 30 seconds, and then we'll repeat it 2 times for adequate stretch effect. All right. So we're done with our stretches. Now let's move on to other form of exercises that we want to talk about. So for example, we have this exercise more for strengthening. So it's talking about sitting to standing exercise. So let's start off by sitting on the chair. So what we will do, place both hands on your hips. For viewers at home, feel free to join us and try this exercise as well. Hands on your hip, lean forward and stand up. So you'll feel a force going through the thighs. James, can we try? All right. Yes. All right. How's this, James? Is it a bit challenging?
No.
Okay. Right, so definitely this is something that we can kickstart, more of an easy exercise that we can do for this strengthening of the thigh muscles. All right, yeah, James, you can take a seat. All right, so definitely if let's say this exercise is too easy, we can definitely talk about some other form of progressions that, when you speak to a medical professional, they'll be able to advise you a bit more on how you can progress the exercises further. All right, so moving on to the next exercise. So we're talking about knee straightening exercises. So what we'll do is sitting comfortably in the chair. James, you can shift slightly back. Right, so I'll get James to straighten his right knee. So just straighten the knee up. So you'll feel a pull at the front of the thigh area. So hold this position for about 10 seconds. And then we will relax. All right, James, you can relax right now. Yeah, so definitely for this exercise, right, we are working a bit more on the thigh muscles. So definitely the thing about exercises is there must be some form of progression. So if let's say you find that these movements are getting pretty easy for you, definitely feel free to seek some professional opinion from a medical professional to advise you on how to progress them further. Right, and now let's talk about another exercise. So just to work on the calf, so what we will do is make sure that you are holding firmly on the chair, do a bit of tiptoes whereby you're lifting your heel off the ground. Alright, so when we do this exercise, we are working on the calf muscle because when we develop the muscles around the area of the knee, it helps to provide a bit more floating and support for your knees as well. Okay. Alright, thank you, Jakes. Okay, last but not least, we have this movement called the foam rolling. So what this does is actually, commonly we see people using this foam roller. The idea is to do a bit of a gentle massage over the muscles, definitely for some relaxation. So you can do this with long sweeping strokes, working repetitively into some smaller repeated strokes, doing this for about a couple of minutes, 3 to 5 minutes, at most for just a gentle relief in the muscles, if let's say they are feeling a bit sore or achy. Right. Okay, so last but not least, we have spoken quite a lot about exercises, but I think definitely some things that we want to have the back of our mind is that in addition to doing exercises, sometimes we need to know when we want to seek some professional help. So for example, like what Dr. Alvin shared earlier on, if let's say pain is persisting and is quite unbearable for a period of time, for example, in about 2 weeks, and pain is not improving with rest, so I think this would mean that we will need to seek some medical attention to find out what exactly is going on with our knees. As well as some other things to look out for would be the inability to pull weight when we walk, as well as some redness and swelling if it's not improving with rest, some instability or knee giving weight, as well as if let's say the knee pain is affecting our daily activities and it's not getting better even with rest or exercises. I think that's where we need to seek some help. Okay, so I've come to the end of our presentation today. So here's some contact points just to understand more about how physiotherapy can help you with your knee pain, as well as seek some advice from your doctors as well. All right, thank you.
Thank you, Marcus. And I was brilliant. Thank you very much for the super informative presentation. We just learned a lot about strengthening our knees, right? Now, ladies and gentlemen, I'm sure you have questions. Now, if you do, please do send them in. And right after this, we'll be having our speakers to join us, all three of them. I'll be starting the Q&A in just a bit. Now, another thing that's super useful, right? Super useful is the My Health 360 app. Now, with this app, it is a one-stop mobile app designed for you to manage all aspects of our health and wellness. Now, with My Health 360, taking charge of your health is going to be really easy. You know why? Well, with the app, you'll be able to book a teleconsult and, of course, your Parkway Shetland doctor on demand or via appointment. You can also choose to book e-appointments and request for MCs, or rather EMCs, with just using My Health 360. You can use it to find specialists, treatments, securely access medical records, test results, and digital bills, get a bill estimate, and much, much more. Right? So, for those of you who like to download the app, all you have to do is scan the QR code, and you have the My Health 360 in no time at all. Now, this moment in time, ladies and gentlemen, guess who's back? Our speakers. Hey, speakers, welcome back. Thank you very much. Now, we learned so much from you via your presentations. But right now, at this moment in time, we're going to take questions live from our viewers from the live chat. Right? So I'm going to address them as we go. Now, the first question is going to Dr. Tay. Now, sir, a person with low blood pressure. Now, does this mean they are at low risk for heart attack?
Yeah, so blood pressure is a well-known risk factor. So if pressures are high, definitely there's a risk factor. But honestly, if blood pressure is low, it doesn't mean that there's no risk for heart attack. So you're having patients actually with, say, heart disease that has affected the heart where your pressure is lower time. So they could actually even have established heart.
It's likely dangerous.
Yeah, so it really depends on the patient. We would look at a major score. If there's a risk of totality, maybe just one risk factor. And perhaps also to find out whether this so-called low blood pressure, is there a specific reason? I think that's the key. But certainly, low blood pressure doesn't risk lower.
That's a great answer. Thank you, Dr. Tay. All right, the next question to Dr. Alvin. Now, BioRay, I believe it's by EBIN, right? The BioRay gut helps with the repair.
Hi, James, are you familiar with this BioRay gut?
I know, we're just Googled it.
Yeah, no idea what that is, so sorry. So I'm going to apologize to this guest, and maybe if you provide a little bit more information about what a BioRay gut is, we can address this. Sure.
We'll get back to this question in a while. Let's do some background check of what BioRay gut is all about, okay? All right, now next question to Marcus. Now, Marcus, I experience occasional pain when I jog. Oh, this is a big question. Should I just walk and not jog?
So I think definitely if you're talking about some occasional pain when you jog, so I think several factors we have to look at. So how long has this pain been, and is it persisting throughout the run? For example, is it occurring at the start of the run, during the run, or after the run? So factors like these actually do affect whether you should jog or not. I would say it's not a straightforward answer to say, because there are a lot of factors that that affect whether we decide that we can jog or not. Because I think definitely if you're talking about walking wise, it doesn't bring on any pain. I think that's fine. But for jogging wise, if let's say we bring on some pain, I think it will be good just to monitor when it comes on. And if let's say the pain is really not improving after say 1 to 2 weeks, then it gets a bit more concerning. Would want to consider seeking some medical opinion to find out what's going on.
That's a great answer, but I personally also think walking is a great exercise, right? And I think if you do 5 click every day, my goodness, that's the reason why the Japanese need to walk, because they really walk a lot. Okay, now next question. Dr. Alvin, back to you. Now, the BioRay gut apparently refers to a product line from APIN. Now, it's a technology to provide support and pain relief, primarily for the knee gut, probably, right? Then these guts often incorporate bioenergy ingredients and may feature tourmaline, a mineral used to heat generating.
Some AI contact lenses that's feeding you all the information. Okay. All right. So, in knee, let me speak broadly on knee guts in general. They are useful for a very, very short period of time when you have acute onset of pain inside your knee. We don't recommend prolonged usage of the knee guts. Now, people like knee guts because they are secure, they wrap around your knee, where you feel very comfortable around the knee. And in the initial period can provide what is called proprioception feedback, lets you know where your knee is at the point in time so you don't even injure it. But over long term, they don't really do anything for you and can sometimes lead to almost like a reliance. So don't recommend knee guts for a long period of time, especially if you have non-associated ligament injuries and you don't need that support. So that's brief, broadly speaking, about knee guts. I think the evidence for additional additives on top of the knee gut, like heat and the minerals, probably not very well studied, so probably can't comment on that. I lose my mind.
That's a great answer. Okay, now let's make our way on the next question. Now, Dr. Tate, if my health report indicate I'm healthy, no 3 highs, which means no diabetes, no cholesterol, no high blood pressure, sun gao, the Chinese call it. Now, it's all great. Just not I don't have any highs, I'm just not an active sport person as well. Will I still be at high risk of heart attack?
Okay, so if you have all 3, that's already congratulations. But there are still some overheated risks. So there will be things like age. As you get older, the risk goes up. 2 is family history. That's very important. If there's a first-degree relative that has early onset of heart attack, to heart disease, or a good stance, bypass before that is also a significant risk. And also lifestyle as well. How you eat, but exercise, power, stress. So that one you have to really discuss with your just your family doctor to fine tune. But certainly if you have this 3 big degree, congratulations, you are aiming to risk.
There you have it. It should be smiling now. All right, now the next question now to Dr. Alvin. Hi, Dr. Alvin Tan. Now, if I have on and off pains at the site of my feet after some walking, is it a podiatry or joint issue? Oh, what's podiatry?
Podiatry is a specialist, allied health professional who specializes in the feet. So I can do things like therapy, insoles, and various modalities that help with pain. Feet pain is fairly hard to address because without examining the patient, there are many causes. It can be through the ligaments, tendons, or even joint issues. Very commonly in someone who has been increasing their tempo of training, then we worry about things like stress fractures, or people who are not wearing the appropriate footwear, then things like tendon strains and ligament strains. So certainly go see your doctor first, and then if necessary, your doctor will refer you to the podiatrist.
Okay. All right, now next to Marcus. Marcus, I've undergone ACL reconstruction a year ago, but until now, I still some cracking sound in my knee. No pains, but I'm still undergoing physiotherapy since surgery. This cracking in my knees, will it cause any issues as I'm getting older?
So I think definitely looking at this, it's good that you're still undergoing physiotherapy. So it allows your therapist to actually work with you, trying to understand your concerns. So the conception of cracking sounds in the knees, at times it can be concerned about in terms of whether is it causing any pain. So it's great to hear that you do not have any pain with those cracking sounds. But at the same time, I would say that we need to keep it at the back of our mind, because the thing with cracking sounds is so occasionally cracking sounds can be contributed by air pockets in the knee joint, which is actually a fluid-filled space. So when you hear some cracking sounds, it can be just the popping of air bubbles, for example. But I would say definitely it will be good to try to understand how frequent these cracking sounds are and whether it is causing any discomfort in terms of daily activities. And I think most importantly, when you have someone following up with you, they'll be able to advise whether it has a need to seek further medical attention to address your concerns. And just to make sure that we do not get too concerned and worried about this cracking sounds.
Yeah, I know when since I was young, whenever I stood up or squat, you always hear the cracking sound. So there's nothing worrying, right? As long as there's no pain and everything.
Yes, that's right.
Okay, cool. All right. Next question now, Dr. Day. Now, are there two advanced tests available in standard health screening?
Yeah, so I think standard health screening, the word standard is really stubborn. There isn't really like a standard one. Generally, the C highs are the most basic, right? And then you have also have patients who request for additional checks. So what we usually do nowadays is quite common, is something called a CD calcium score. So it's a CT scan test that is very low in radiation, just to look at whether the calcium deposits in arteries. And that gives us an additional score of how high risk the patients may be at or having artery blockages. And then there are advanced tests now, quite popular, something from lipoprotein little a is a special kind of cholesterol that have that and detail risk is higher as well. So there are a lot of new things in our stream for but the kind of heart is through.
Thank you very much, Doctor. All right, now, Dr. Elvin, now what is the remedy if cartilage has worn out, and causing pain to me, especially standing up after prolonged sitting? Is there any remedy?
Yeah, cartilage is a very special soft tissue in the body. We always say that cartilage is avascular, means there's no blood vessels in it. It's alymphatic, there's no lymph supply to it, and it's no blood to it. So because of that, it has very, very poor because there's no source of nourishment for the cartilage. So if your cartilage has worn off, it's really down to bare bone. Unfortunately, there's nothing we can do to make cartilage grow. So in that situation, especially when you're symptomatic, then the knee replacement is right. Your answer.
Okay. Let's move on to the next question. Now, Dr. K. I'm sorry, to Marcus. Now, Marcus, is it good to stand the whole day whilst working? What about prolonged standing? Can it increase risk in knee pain?
So I would say that so it depends in the sense of when we have work requirements that require us to stand the whole day. We'll need to see how we can try to inject some short breaks to actually reset and change the body position. For example, taking sit maybe just for 1-2 minutes and get back to standing. So the thing about prolonged standing is it will involve our muscles having to work harder around the knee. So definitely when our muscles are perhaps at times when we are standing for longer, it means that the muscles will need to work even harder, especially the front of thigh muscles, back of thigh muscles. So definitely when we are standing for longer periods, there'll be more forces going through the area cumulatively for the extended period. So it's possible that may be causing some knee pain, but not 100% correlation that prolonged standing will actually result in knee pain. So I think definitely, for example, if you're having such issues, it will be good to consider seeking further opinion as to whether are there some factors that are addressable and try to manage them from there.
Yep, that's a wise answer. Now, Dr. Tay, I have a bypass using MICT. Now, there is still pain in the chest intermittently. Now, doctor, you mentioned that this was due to, or his doctor said that this was due to injury on the muscle due to surgery. How do I know this is a muscle or a heart issue?
Okay, so there's some basic principles to kind of guide patients, especially when they have pain, right? So in general, it is a heart-related pain. It's usually brought up by exertion. So if you were to walk or climb stairs, or something where you require heart rate to go to a class, you will feel for a start. Conversely, if it's a chest wall problem, it will be brought on you without the thorax, so it won't stretch into the position, it make the pain worse. Those will tell us it's more likely a plastic. Right. So if it's exertional related, that means you're walking, you're not moving up a thorax, but you feel the pain here, then that is more likely a heart. Really. So that require the doctors to evaluate that. And of course, there'll be specific tests. Or even things like ultrasound scans or even an echo or any say a scene scan. And I look at whether it's true.
And of course, if it's muscle related, isn't it?
Yeah. So the main thing is if the symptoms are persistent and it's affecting patients, it's not going away with pain or even out of that. It requires something.
There you go, persistent and causing pain. Okay, now, Dr. Alvin, does regular high impact exercises causes osteoporosis or osteoarthritis?
Yeah, certainly. If you think it's high impact injury, every occurrence of that damages the cartilage a little bit. Over long term, they can lead to arthritis. A very good example would be, National Day coming around, see a great lions jumping.
Oh, yeah.
All the commandos all going in problem because every time they jump, they have a little bit of cartilage damage. Now, the truth is, most of us don't get such high impact exercise. So jumping jets perfect, right? No problem. Yeah. So how to balance things? Yeah, high impact things certainly can cause problems. So, but most of the exercise that we do are not that bad. So I would say on the balance of things, it's much better to exercise than to not exercise. Once you exercise, you get the muscles stronger, you keep the weight off, you circulate the joint fluid by moving your joints. That's good for the.
There you go. Thank you very much, doctor. All right, now, Marcus, I like to jog. This is similar to the previous question.
Yeah.
Is jogging bad for stiff knee joints?
Yeah. So I would say that no particular physical activity is bad per se, but rather we'll need to see what symptoms are limiting you. So for example, if you find that jogging is a bit challenging because the knees feels a bit stiffer, we can kind of consider some exercises that's a bit gentler on the joints. For example, like assisted cycling, or even swimming in a pool whereby the water buoyancy helps to offload the body weight and gets a bit more of the movement going on.
Great answer. Dr. Tay, can you repeat what was the internet calculator that was mentioned by Dr. Tay for the risk profile? Thank you.
So the one that we mentioned earlier at the top was a modified Singapore Framingham risk score calculator.
How do you stop?
Framingham, Framingham.
Okay, so for the benefit of you, just one line, the Singapore
Framingham risk calculator.
risk calculator. Dang.
So it's basically very nice for Singapore because they actually validated Singapore patients. So that's why the scores are a bit more predictable.
Wow.
Kind of
Customized signals, yeah.
There's also the American scores and European scores, which also has some calculators of their own, but this one is specific.
Right. Yeah, I get you. Okay, Dr. Alvin, does the same question here.
We've answered this.
Then does running increase wear and tear of knee? Well, we've answered it before.
Yeah.
Next question, Marcus. Now, thigh stretch. Must the raised thigh be vertical or can we put it back at an angle? Thigh stretch.
Okay. So I believe there's talking about the stretch that we need standing up, pulling the leg backwards. Yeah. So the one of the thigh stretch, right? So generally, if placing the leg vertically, if you feel a stretch, the idea is a mild comfortable stretch. So if let's say putting the leg vertical, you really feel that gentle stretch, that's fine. However, if you don't really feel a stretch, pulling it slightly backwards to achieve that stretch effect, that's fine as well. Because the concept is that mild stretch, so we hit that intent rank. Okay, yes. So back to Dr. Tick. Sir, for mild artery blockage and severe heart valve handling issue that requires repair surgery, does it cause any eating or swallowing problem or affect my basic mobility movement? For example, like getting up and out of bed, lifting up the things.
I don't think usually heart valve conditions don't usually affect mobility unless it's been established for very, very long. But generally, they don't affect swallowing and basic movement usually not. Most common symptom actually is short. So it's a very severe heart valve conditions, typically the most common symptom beyond.
Yeah. Okay. All right, now, Dr. Alvin, there are some soft cracking and popping sound when the bed is straightened my knee. Since young, this popping sound has been loud when squatting down, but then the sound evolved to softer. Is that the issue here?
Yeah, so I think very common questions. People always ask about this cracking stuff. In fact, I saw another question just now. They say it sounds like Rice Krispies. That's the best description I've ever seen in my entire career. But anyway, if you have sound without symptoms, You can ignore the sounds. Why do sounds occur? Marcus mentioned some cavitation bubbles inside the knee. Sometimes you have soft tissue and ligaments or tendons that rub against the bone. But usually that's sure. So people with arthritis almost always have sound. But if you have sound, it doesn't mean you have arthritis. So as long as you've got no pain, you've got no symptoms, it's quite safe to ignore us.
But there you go. Someone has finally answered this question. A lot of us had in our minds for the longest time. So as long as there's the sound, there's no symptoms, there's no pain, it's okay. It's okay. Thank you, sir. Okay, now next question, Dr. Tay. Having SCAD and high blood pressure, what is the chances of having another heart attack? Is there any way to improve conditions? So, sir, firstly, what's SCAD?
Okay, there are few things, but I think SCAD for cardiologists usually means a spontaneous coronary artery dissection. So which means the arteries themselves is not due to a blockage, but suddenly there's an event that causes a tear in the arteries, and that tear kind of generates blood clotting and blocks. In these patients, sometimes they may not even have artery blockage or blastron. So typically we see that in patients who are like the high risk period is sometimes pregnant women. Some unique situations they are at higher risk. Some patients have congenital conditions where their tissue is just more fragile, there is spontaneous tears. A lot of times the treatment are really quite conservative. So maybe there isn't a thought that you need to, unless there is cholesterol deposits. So treating the risk factors does help. So if this person has high blood pressure, treating blood pressure will help as well. But generally, it will heal. You'll heal and then you'll live that sometime. In very rare restrictions, if it's very bad, it affects blood flow. Sometimes maybe a stent 1 year. So generally, we don't need to stent things if the blood flows okay right down, right by eye.
Thanks, Doc. Okay, the next question now. Dr. Alvin, can you repeat what collagen type helps with cartilage knee pain? Cartilage claw knee pain.
Type 2 collagen, and there are many types of collagen. So specific to cartilage type 2, and what you want is to look out for undenatured cartilage. Undenatured collagen means collagen that has not been broken down into this peptide.
So the beauty type. Yeah, type 2.
No, type 2 can be type 2, but the ones people take for their skin has been broken down into its individual fragments. Yeah. So we don't want that for cartilage.
Got it. All right. Now, at this moment in time, let's move on to the next question. Now, Marcus, does black coffee impact osteoporosis and osteoarthritis? Does black coffee create any kinds of worsen any conditions of osteoporosis or the onset of osteoarthritis?
So from what I understand, based on the research on CASPA, there has been not so much of a linkage to like say black coffee relating to osteoporosis and osteoarthritis. So I would say unless being advised otherwise by say your dietitian or even your family physician. So I would say don't need to avoid black coffee, for example. Yeah. So so I think it will be good to check back with a medical professional so they're able to advise better on that, because plenty of times we are able to find out quite a bit of information online now.
Yeah, it's scary though. Understood. Okay. Now next, Dr. Tay. Now, how often should one undergo a heart CT scan to ensure the initial calcification detected in the previous CT did not worsen? That's a question.
So there isn't actually a specific guidance on when to do this, but I think the most important thing is once the CT is done and it's clear, the patient still has to be very good, is restricted. So that to get back to nice, you can get cholesterol, diabetes, blood pressure well control. But there is sometimes patients who have developed poor control, and if those patients perhaps some 5 years,
5 years. Thank you very much. Dr. Alvin, now how do you treat knee pain when bent at the back of the knee due to ITP?
Yeah, so ITP refers to the iliotibial band, and the iliotibial band is this huge muscle that comes all the way from the hip all the way down to the knee. ITP tendinitis or inflammation of the iliotibial band is often runner's knees. So it's a friction syndrome where the tendon rubs against the bones, right? It's a little bit unusual for this to be at the back of the knee. So when you have pain from ITP tendinitis in the back of the knee, it may be something else. Only associated conditions would be a hamstring tendinitis or maybe even a meniscus tear. ITP tendinitis, if it's the only cause of pain, is treated with physiotherapy. Almost never requires
Right, so that's okay. Now, Marcus, now for elderly around 70 years old of age now with a bit of both legs, is it recommended to get some insoles? Can that help me to ease any pain or discomfort? Or is there any recommended retail shops to get some insoles if required? Yeah, I remember during army days, we had this special insole put in our boot. So for elderly, is there any kind of insoles you can recommend? Will it help?
And so I would say this is really dependent on how the elderly is presenting the first place. So for example, talking about so I think some things that we'll need to look at is, for example, in your physiotherapy session, look at how the individual is walking. Is there a particular preference to one side, for example, and whether what is the cause of this knee pain per se, and whether when we put the insole in it, whether would it change the pain to perhaps even make it better, or unlike the lower likelihood scenario, we do not want to make it worse. So I think definitely I would say that. So when we talk about insoles, generally insoles they can be bought off the rack. So perhaps trying it out to see whether it helps you. There's no harm doing so. But if let's say it worsens the knee pain, I would say perhaps it'll be not so suitable and to seek more advice already got it.
Yeah, this seems like a bit general question. You need to get a professional to help you find out if there's any other problems. Okay, now, Dr. Tay, what are the healthy habits to prevent heart artery blockage?
Yeah. So this is addressing the risk again. So I think firstly, if you don't smoke, and two is encourage healthy lifestyle, which means exercise regularly. You heard about all good things, Mike. So it's very good for the heart. When we say exercise, we require at least moderate activity for at least 4 or 5 times a week. So a significant about it. And then more of a plant-based diet. There are a lot of different types of diets in here. Some are good for high blood pressure, some are good for diabetes, but with cholesterol. But generally, you look at them all, more or less, they are towards more plant-based. So less reliance on processed food, trans fat, all those made to be processed food, inflammatory foods. Those should absolutely got it.
Oh, there you have it. Next question, Dr. Alvin. Bolic needed to go for operation to permanently solve the problem. Is it safe at how much?
Well, I think generally if you have bowed leg, that is a structural problem. It's not something that insoles or braces can help you with. Why do you get bowed legs? Because the cartilage on the inside of the knee is worn out. A lot of people are born naturally bowed-legged. So if you look at a lot of football players, they're all naturally bowed-legged. So if it's just a cosmetic issue, bowed-leggedness without any symptoms, and I think is something to be retreat surgically, right? We usually leave it alone. Right? There's pain, then in an elderly patient, then we do a knee replacement surgery. In a younger patient, what we may do is called an osteotomy. And what an osteotomy is where we essentially break the bone, we straighten it, we put metal plates inside the bone to realign the bones. So that may be a very good option in a young patient with bowing and SD.
There you go. That's a great answer. Thank you. The Marcus, how do you boost vitamin D? Sunlight may not be enough for those already having low vitamin D. Supplements may also not have the most be the most absorbent, I think. Is there any other ways to increase vitamin D?
So I think if we are talking about vitamin, usually blood tests are done to try to understand the level of vitamin D in an individual, for example. So I think it's important to track how the vitamin D is like. And then usually from what I understand, you will be taking in some supplements. But from my understanding, I don't know of any particular item per se that will help to increase the vitamin D levels. I'll say at the same time, all this will involve blood tests to regularly monitor how the levels are like and whether at low levels it increases the risk of things like osteoporosis. So I think definitely having it continually follow up will be rather helpful.
Maybe I can help Marcus with this. To get enough vitamin D, you need to be in the sun, unprotected, in the hot sun, like 15 minutes a day. Alright? And I think in our weather and our climate, nobody wants to be in the sun for 15 minutes.
So you're saying no sunblock?
No sunblock. I was like, no sunblock, myself don't go out. But nothing, unprotected, 15 minutes.
Right, how much vitamin D?
To get sufficient vitamin D.
Sufficient?
Yeah. So if you are low or you need replacement, then you need pills. All right. So regularly our diet, green leafy vegetables have a lot of vitamin D, but may not be enough. So you need some supplementation. If it's very, very low, then we need to quickly boost it up at 50,000 units a week. But if it's at a moderately low level, then we do a supplement maybe 1,000, 5,000 units a day.
What about the morning side compared to the afternoon?
Oh, good question. I don't know. Yeah, but I suspect they mean hot afternoon, Sunday, yeah. Which is why even us that in the tropical weather, you are so low in vitamin D because the world wants to go outside. Yeah, that makes sense. Especially in this weather.
Yeah. Dr. Tay, I have irregular heart rhythm topics. right? If I pronounce it correctly. Now, I understand that this is a risk factor for heart disease and stroke. Now, how can I control this risk factor? Basal heart rhythm.
So ectopics just mean extra hearts to basically, and it could come from upper chamber, lower chambers, but essentially you need an ECG diagnosis. What kind of extra heartbeats? One of the ones that we're concerned about is when the ectopics change with irregular heart rate atrial fibrillation. And many people now have this thing of a smartwatch or something like Apple Watch or Garmin or whatever, right? They have the ability to pick up this abnormal rhythms. So if you actually record the watch and it tells you your atrial fibrillation, then you can see it out. Because that is a high risk with the increased risk of stroke. So that requires the medications protection.
Right. Thank you, sir. Thank you, sir. All right, let's move on to the next question. Now, Dr. Alvin, what's the difference between UC and hydrolyzed collagen? Which is better for joint health?
Yeah, so like we mentioned just now, hydrolyzed collagen has been chopped up into its individual peptides really. So it just works like a building block. Whereas we use an undenatured or a natural collagen, which is the UC collagen, for the immune function that it's had. So for joint health, we use the undenatured collagen.
Right. UC. Okay. Now then, Dr. Alvin, I have a tingling pain at the back of my both thighs. Now, is this a symptom of sciatic nerve disease?
Yeah, it may be. But a typical sciatic pain goes shooting down, goes like lightning from the back all the way down to the toes. Pain in the buttocks may indicate another type of nerve injury, so specifically at the alpha S1 level in the spine. So may not be sciatica, but very closely related.
Got it. And the final question now, Dr. Tay, can I overdo high blood pressure medication? Now, for example, I continue to take the medicine such that my blood pressure becomes too low.
Okay, so the blood pressure is something that there's a kind of average and one and keep them up. Plus, if it's too low, it's not good. This one, you have to actually look at your risk factors. Also, you need to speak to your doctor. Sometimes you want to pressure to be potentially lower for specific reasons. But if you feel that you are feeling dizzy, your pressure is low, really probably should to speak to your doctor. Why that's the case, and perhaps if it's too much, the dose can be
right. Thank you very much, sir. Well, ladies and gentlemen, we thank you very much for your questions, but we're sorry we can't get to all of the questions due to time, but we really appreciate you spending your lunchtime with us. We really do. And we hope that you found this webinar useful just as we had. So once again, thank you very much, Dr. Tay, Dr. Tan, and Marcus for taking time to share with us all about heart attacks and knee pain. Right, so now before you go, ladies and gentlemen, again, well, you know the drill. Please do share your feedback form or rather your feedback on today's webinar via our survey by scanning this QR code that you see on screen. Now, well, if you do that, you'll be able to share with us the topics you'll be interested in for future webinars. So please do keep a lookout for future invites. Your feedback is important to us. First 20 of you today to provide feedback will walk away with a $10 Grab transport voucher. Right, so we're going to give you some time to scan the QR code. And of course, we know it's lunchtime. Thank you very much for spending your lunchtime with us. Please do give us your feedback. Let us peek into your thoughts and let us know what is interesting to you, what's not, so we can further fine-tune our program in the future for you. Right, so we hope you have done that. Now, ladies and gentlemen, again, thank you very much for your time. You know what? We will be flashing the details of our speakers in just a bit. And of course, stay with us if you'd like to have the details. This webinar was brought to you by iXchange, your trusted TPA and medical services provider. Please feel free to email us if you have any further inquiries after today's webinar. And we hope everyone stays happy, safe, and healthy. So thank you very much for joining us. Goodbye. Thank you very much. See ya. Thank you.